Is it okay if I?
Sure, certainly.
Okay. Everyone, this is Aaron Abraham with Cascade Insurance. He was nice enough to come up and do this presentation for us. Although, obviously, there are other people who provide insurance coverage, he was the person who volunteered to make this long drive to do this presentation for us. So we really appreciate the fact that he came up and will hopefully explain insurance in a detailed way that I have not been able to so far. So thank you very much.
Thank you.
Mr. Abraham.
Thank you. So, well, as you guys know, you're in a unique place, right? So one of the conversations I had on the way up here actually was with a representative from one of the large insurance carriers. And I had to drop the call because I was going across the border and then pick it up again, right? And they said, where are you? You know, you crossing the border or whatnot? And I said, yeah, I'm going to Point Roberts. Where? Point Roberts. So I had to describe the 49th parallel and where it's all. So, you know, that's what you guys face, right? And so part of my job is to be an advocate for you guys. You know, I am an insurance agent as well, so I do represent my clients, and I see some of my clients here, in fact, as well. So that's what I do. Just really quickly before we get into this, I have to project that. Those are my twin girls. They're a little older now, but this was a good photo anyhow. So, yeah. And then let's see if I can find. That's my son. But I think I have, there we go. That's a little bit of chaos at that moment in particular, but they were squirming all over Mama, which is my wife there. And so the girls are now 5. My son is 8, they're turning 6 in December. He's turning 9 in January. Wow. So a little bit about me. Wonderful family, and I love them. And they don't see much of me during this time of the year because of the Affordable Care Act and Medicare enrollment season. So those of you who are familiar with that, you know how busy we can be because all the seminars. So jumping into this, well, actually just a little bit further. For those of you who are on Medicare, this is going to be kind of a multitude of discussions going on at once because there's small group coverage, there is individual coverage, and there's Medicare coverage. And so it's going to be different conversations, and you're going to have different questions, and I can field any of those questions. I do have, if you have specific Medicare questions and wanting to know about certain plans, I do have seminars coming up here, I believe on the 23rd and the 13th. So the 23rd of October and the 13th of November. So if you wanted a flyer, there are flyers up here. There's also my business cards, brochures about our agency. We do more than health and life. We also do home and auto and commercial as well. And also snacks, goodies. So this is a good bait for you to come up and then you can grab the other stuff as well. So, talking about what you face here on the point as far as trying to get coverage here and carriers here that will work locally, right? So I've already talked about Cascadia Insurance, but if you do want to know more, our website is there. We're working on a new website with CascadiaINS.com. We own that domain too, so you can always email me at Aaron at either one of those, CascadiaInsurance.com or CascadiaINS.com, or anything else. Well, there's a couple other domains, but anyways, that's contact information. This is my team. So Crystal on the left there is primarily home and auto and commercial, but she's kind of a jack of all trade as well. But her specialty is property and casualty, so personal lines, home, auto, commercial. Myself, Mariah is our admin assistant and also marketing coordinator. And Lynn is small group benefits, but he also does health and Medicare as well. So both Crystal and Lynn help me with the health and Medicare side. So, where we stand right now, obviously the point, but I sent this to Deb and Barbara as well. As far as, you know, this whole population, not just the point, but all of Northwest Whatcom County, there's, in those green spaces, 16,000 people. Now at this point, there's really only 2 clinics that serve those 16,000 people. And at this point, there's only one doctor, but then there's also a physician assistant, Deb, and also I believe 2 ARNPs over in Birch Bay, but that's not really convenient for you guys either, right? So this is the case that I'm trying to make with some of the carriers, that they, again, you know, you talk to a rep and they're like, where is that? Where's Point Roberts? So explaining that a 1 hour, there's general consideration for what they call a network adequacy. So is the network adequate in the area for our clients, right? They consider 1 hour drive time to be network adequate. You're just kind of on the verge of that with the one clinic that's around the corner there, but they don't realize, okay, you've got 2 border crossings, right? So this is unique to you. And so this is where we're trying to step in, and I'm actually in communication with several of the different carriers, and all of them have responded quite well, in fact. So, well, I shouldn't say all. All the ones that I've talked to have responded quite well, and they hear the concerns that I've been bringing up. But 16,000 people, including, I believe it's 1,300, I believe, here on the Point. Is that right? Yeah, 1,300 here on the Point. And so trying to have the care that the SuperTrack Clinic and Deb and Virginia are trying to bring, or was Virginia, trying to bring, that's important for you guys here because it's just such a trip around there. So we are hearing from obviously one carrier, if anyone wants to name the carrier, that has been having a little bit of trouble contracting here.
Kaiser.
Oh, there we go. Good. Volunteers. All right. So, you know, to be forthright, I have a conflict of interest here. I am contracted with Kaiser. I do have Kaiser clients, Kaiser Permanente clients. In certain areas, that's good. In other areas, it's not. But I'm contracted with a variety of different carriers because it's not a one-size-fits-all sort of situation. They have been it's been an unfortunate situation. They have, if you haven't heard, they've completely left San Juan County. So that's 1,900 individual clients that are losing their coverage this year, and 823 Medicare clients that are losing their coverage this year. So, yeah, 2,700 clients in the San Juans that are losing their coverage. So, we're running seminars out there. But that's a whole lot of people that need to get assistance this year. So there's unofficial talk about that carrier having some issues with contracting with some of the large hospitals and things like that as well. And that's unofficial, so I can't really say anything more than that. But we're just kind of waiting to hear where they are going to be contracted, where are they going to even be at all for 2020. So, so that's what we're left with. At this point, it's an option that we know of, but they don't work with the clinic. And the clinic has done a phenomenal job of trying multiple times. The one option that is still around here, which is writing letters to Washington OIC. OIC is the Office of Insurance Commissioner. So insurance is kind of a self-regulated industry. We do have one elected official, that's Mike Kreidler, and he is the Office of Insurance Commissioner. You can write complaints about your specific, it has to be specific situations. So you had a date of service, you know, that what they call a date of service, which is when you went to the doctor and you had a claim and they denied it. So if you have, just show of hands, how many people have Kaiser currently? Okay, so almost half the room. Yeah. So specifically for those who have Kaiser, if you have a date of service, so you went to see the doctor and they denied a claim, then you can write a letter for stating why you feel that they should be covering the clinic here. Talk about that geographical location that we have here. Talk about the map. Talk about the inadequate network because of the location here. You can mention that we have 16,000 people in Northwest Whatcom County that are only being served by 2 clinics and limited staffing because of the population and just kind of outskirts that are kind of neglected by the insurance carriers. but they need specifics,
Is
yes?
it okay, can you write a letter of lack of date of service because of the situation? I'm in a position where I haven't talked to my preventative care.
Yeah.
Because, can you write about that?
Absolutely.
There's no specific,
Absolutely,
Okay.
yeah, absolutely, good question. Yeah, if you can't get that data service, you can't get that, that visit, then absolutely write about that, because that shows the real need there, right? So yeah, you know, some clients have been fortunate enough to have Kaiser pre-approve their visits to the local clinic because their primary care physician elsewhere on the mainland has said, look, this client needs local access, and so they started to pre-approve that, but they're not doing that anymore. They've just kind of put a stop to that. So, did you have a question?
Well, no, just to say quickly that they advertise falsely on television because they always say on these big fancy ads on their television, and we serve everybody in the state of Washington.
Yeah, that's true, yeah.
So that's one thing.
Yeah, yeah. So, you know, obviously attending other clinics, technically it's an option, but it's not a very good option here on the point, and you want that local access, and your physicians do a great job. So, paying out of pocket, changing insurance coverage, writing letters to Washington OIC. Those are really more of your key options here. So, paying out of pocket, it's technically an option, it's not a great ideal option. Changing insurance coverage is an option, and that might be what we have to do if we don't get good responses from the OIC. Well, and just to clarify on that, I should talk a little bit more about that. So OIC, they don't, unless there's a whole slew of complaints, which hopefully there could be, they don't take direct action. They forward these complaints directly onto the carrier. Now, if there's enough activity going on, then they will do something. And I've seen two instances, one with a dental provider and one with a health insurance provider, where OIC stepped in and said, you have claimed to have this network adequacy, and you don't. We're putting a cease and desist on your enrollment. You're no longer allowed to enroll anybody until you take care of this. And you bet that gets their body is in action there. I mean, it's real fire under their feet pretty quick. So I have seen that happen, but it does take a lot to bring OIC to bear on that insurance carrier. And those were different carriers. That was not the one that we're talking about here, but those were different carriers. So it could work. At least it'll get them to take notice. So the change in insurance coverage, there are a number of options here, and let's see. Deb was kind enough to create a list of what is in network and what is out of network. So if I could actually just split these up, and then if you guys could pass these around, hopefully you have enough there. And if you could share, if you're couples, if you could share, maybe just so there's enough to go around.
I can make more copies.
2020. Yeah, 2020. Yeah, as far as Medicare goes, I have contacted Premera and United Healthcare. And so far, those are good, and I believe those are on the list already.
Yeah.
So Premera and United Healthcare, Humana is aware of the situation. They just had a network meeting on Friday or Saturday, and they are aware of it. They're working on it, trying to. They said they would be reaching out to the clinic. I don't know how quickly that would happen, but we were told. Going back in history a little bit, we were actually told when SuperTrack was coming on board, coming up to the point, I had contacted SuperTrack. They said, yes, we're going to be contracting with all the carriers, and they did attempt to do that. They did their best effort to do that. Some of the carriers didn't respond accordingly. And so, you know, some people enrolled expecting them to be on board, and we were expecting them to be on board, those carriers to be on board. But nothing was in writing yet. The clinic wasn't up and running yet, so nobody had any ideas on that. So,
So Aaron,
yes.
this says that Primera is in network. I've gotten a letter from them 2020 under the exchange. They will not be servicing Whatcom County.
So right, so two different discussions, thank you very much. So Primera Medicare is going to be working with the clinic. Primera Individual Market is going to be LifeWise. It's their sister company. And so it's another one of those really painful transitions where they, for whatever reason, they're taking Primera out of the county, but putting LifeWise more front and center in the county. And they're the same company. It's sister entities of the same entity or the same company. So I don't know why, but yeah, let's talk in November when that enrollment season comes around. Yeah. Thanks for bringing that up because I forgot to mention that. So LifeWise is coming in, filling in the gaps in a lot of places where Kaiser and/or Primera are leaving. So
Quick question.
Yeah.
It's called LifeWise, is that?
LifeWise.
And are its premiums as high as Primera's?
So actually, I don't have the premium information yet, but on the conference call that they invited us to participate in, they said that they were, a couple of their plans were going to be just as competitive as the big carrier out there, which was Kaiser,
Right.
but they wouldn't name that.
Okay.
So yeah, so I'm looking forward to some good rates,
Okay.
but we haven't seen them yet.
Okay.
Yeah.
That'd be good news.
Yeah, absolutely. And then, of course, with the individual market, now this is not talking Medicare, but with the individual market, there is that sliding scale. If you're below 400% of the federal poverty level, then you have a sliding scale on the premiums. So your premiums will come down as your income goes down proportionally. So, other questions at this point?
Excuse me, you were making a distinction earlier with Primera. So I have Primera currently, and I've got the Advantage, so that it stays, correct?
That's correct.
Okay,
Yes.
likewise is individual. you said.
Correct.
Okay,
Yes, thank
got
you.
it.
Yeah,
Yeah.
thanks for that clarification.
Because
So,
we have that too. And I just called them about Medicare and I knew nothing about them pulling out.
Okay, so
they haven't told you anything about the points, is that what you said?
No, they haven't, they're not pulling out.
Oh, that's the
because
advantage.
Medicare.
That's the Advantage.
Yeah, we
Yeah,
have
right.
that.
Yeah,
That's
we have
correct.
Advantage.
Correct,
Right. Primera Medicare Advantage.
stays.
Yeah, correct. Yeah.
But in the meantime, we're still on Primera because we haven't gotten the Medicare yet. I just signed up for it. And I've gotten nothing saying that their coverage is going to be cut off.
So from your Primera individual plan, is that what you're saying?
But it's through a government agency.
Okay. Then that again might be another situation because if you have a group plan, the group plans can be in certain areas that an individual plan can't be as well. So for instance, I can write a Regents group plan for a business, but Regents doesn't have an individual plan here.
Okay.
Yeah. You had a question?
Yeah, I just wanted to know how to read this table. What does the column Deborah mean versus what the column Virginia means?
That's our two practitioners that are here on the point. One is Deb Shields, our PA, and the other is Virginia
That's what they said.
Lester, who was the ARN.
And so they accept
And so
this.
well, it's got to do with how the whole thing with the credentialing went through. Credentialing is something that goes on all the time. I used to be a credentialer, and I can tell you even I don't understand it real clearly. But as a practitioner, you are credentialed with certain companies. And pretty much if your clinic is credentialed, then you are. But because Deb as a PA and Virginia is an ARNC, that can make a difference. That's what the insurance company is going to cover. So this is just a thing for you to understand that right now, at this moment, these people can see patients and be reimbursed by the insurance based on that. But by 2020, all bets are off, right? Particularly for Medicare.
It can be. So a lot of the ones, and you're right. At this moment, that is what is accurate. So some of them, so for instance, some of the carriers, well, you know that this clinic here used to be part of Interfaith. So some of the carriers have cut their contract with Interfaith. So we would still be having the same conversation if Interfaith was still here, because some of the carriers have cut their contract. So that's for 2020, but again, you know, those things change as of January 1. What I'm being told by some of those carriers that are on that list is that they are fine with the clinic. The one uncertainty is, what does it say about Humana on that list? I don't have that in front of me.
It says Aesthetic Network.
Outside network?
Yeah.
Yeah, and so that's, I was in communication with them, with their provider relations director, and also our rep, our local rep, and then indirectly with the whole team that contracts all the various providers and everything. So it's high up there, it's well known. And actually, they're anxiously scrambling to try to contract as many of the providers that are getting dropped by the other carrier. So they are looking to contract with as many as possible. And so I put the Point Roberts front and center on their agreement. So they had talked about it just on Friday or Saturday whenever they had that conference. So, yeah. So again, it is a different conversation for each situation though. Medicare versus the individual market versus small group benefits. If you have an employer plan, that's different.
That's what we have.
I have a follow-up. Also in this table, there's in-network, or there's in-network under SuperTrack. How are those two different?
Let me take a look at that again.
It applies to Cigna and TRICARE.
Yeah, I should probably check with Deb about that. My guess is that, oh yeah, thank you, you could. So in the in-network under SuperTrack group, so I know there's the Bellingham and Roberts Clinic. Are there other, is there a larger group?
No, okay, so SuperTrack Urgent Care in Bellingham, the head office is on Lakeway, and they have a couple of other little clinics. The couple little would be the one Cigna and Worthy out of area. That being said, when it says that it's covered by network of SuperTrack Urgent Care, we would be covered as well, but it would also be, you know, because we're looking at Deborah and Virginia separately as well. But SuperTrack itself has it, and we kind of fall under their umbrella.
Okay, I see, okay. So it's contracts and then there's the whole group, not the clinic specifically?
Correct.
Okay, I see, that makes more sense, yeah.
Yeah.
So, and you'll notice Kaiser says PPO only, no HMO. The only way to get a PPO through Kaiser is with a small group. So I have clients that have Kaiser PPO, and those are businesses, small businesses that have their PPO plan. That's also not available in Whatcom County. So the only way, it's not contracted with the clinic under their HMO. The only way you can have their PPO is if you worked for a company that was in Skagit or Snohomish and you lived here, then you'd have their PPO plan. Yes?
Well, based on past experience, did you expect, I'm not a Medicare, I'm just in the private market, I guess, so Obamacare. When the health plan site is up and running for the open enrollment period in November, would you expect the system to be populated with it? That when we were looking at different options, you can tell they're providing coverage here, or will it be uncertain?
So they have a doctor's tool on there. So you can enter your doctor and find the plans that contract with the doctor. How accurate that is, I can't tell you, can't guarantee. But they do have a tool there, so you can actually enter your doctors and also prescriptions and find the plan that might work best for you there. Yeah. Other questions?
I didn't understand what the answer was for the difference between.
Oh, right. So SuperTrack group. So when, and Barbara could probably talk about this more, but when a clinic goes through the credentialing, it can be for that location or it can be for the whole group and network. And so those two are for the whole group. the whole SuperTrack group, all 3 clinics. And the other ones are for this specific location. They might also be contracted with, for their other locations, but they're on an individual or a per location basis. Is that, am I explaining that right?
Yeah, and I think part of why that occurred is because at the time that they began credentialing for this location, they had just gone through credentialing at their main location. Their credentials were quite new. And so some of the organizations just rolled us into that existing, because usually credentialing is for more than just a year, it's for a window. And so in that case, if they had just been credentialed, a lot of those places went, we'll just look at the people that are joining, which would have been our provider Deb, but they just rolled her in underneath the existing. Or the other ones, the time frame or the fact that we had that one SuperTrack but not contracted with, made those be ours just as they had always been. It was an individual contract. It just showed that now SuperTrack would bill under that.
So for our purposes in selecting a program, they're all somebody who covers Point Roberts Clinic and
Right.
say in
You just want to know that you will be, if you submit a bill that you were seeing here, it's going to be honored, or it's not because we're part of it or we're not part of it. And that's what's important to you. And it has nothing to do with whether people are licensed or anything. That's, I mean, they look at that when they're credentialing someone, but it doesn't come down to that and who we have and who we don't. It really comes into what area are they willing to cover care for. And that's what's happened with the HMO, is they're saying, we're not going to do HMO that far from our hospitals and our clinics and our doctor's offices.
Right.
Well, I was thinking that there must be a little extra concern though, to the extent that some of these providers who are credentialing have already credentialed Deb, for example, that haven't necessarily credentialed Virginia, based on this list of something that she's not in, and now that we're having service from both of them on a regular basis, it seems like it's going to be an issue for patients.
That I don't know, because it hasn't been, and this is the current status. So we have to ask. I have no idea if it's been an issue, because this is the current status and this is who we're seeing. And Virginia sees patients here. And I don't know the answer to that, so I'm not going to.
Other questions?
Well, you mentioned Lifewise, and it's not on this list, so can you
Yeah.
tell us more about
We do need to look into
because
that.
that seems like, for someone like me who's done a lot of research, that seems like the first viable option that I've potentially seen, so I just want to know more about
Yeah.
Lifewise.
On the individual market,
Yeah.
yeah, that's one we need to find out about for Likewise, because that one is going to be, I can't say the best, but it's going to be one of the main options on the individual market, not the small group, not the Medicare, but on the individual market. Likewise is probably where we're going to be looking at. So yeah. It should be easier though, because Premera, we were contracted with Premera, it should be easier to get that credentialing and you network with Likewise.
And how long does it take to find out, like, will we know before open enrollment is over?
I would give them a call. I don't have a direct contract or contact with their individual market, otherwise I would just make a call. But so I would reach out to them tomorrow maybe and just find out how quickly they can get that information turned around. Yeah.
Thanks.
Yeah. So, if you have any follow-up questions or anything like that, I'm going to just pass these around. If you have, let's see here. If you're on Medicare and want information about this seminar, you can take one of these flyers. If you want follow-up questions or anything, I'm going to pass around the cards. You can take one. Let's see. Cards pass around there. There we go. And then at this point, I'm not doing, at least I don't have an individual market seminar scheduled, but I might, on those days that I have those Medicare seminars, I have the community center booked out for 3 3:30 time slot. I just haven't decided who's going to be the best carrier, the insurance carrier to present. So it might be an individual market with LifeWise. It might be a presentation for LifeWise individual, but just you can call or email me if you want further information or if you have further questions. And of course, also if you want myself or Crystal to help with some of the other Omerado, we're always there
So
too.
that's on the 23rd from 1 to 4?
October 23rd, it should be 1:30. Should just be 1:30 to 2:30, and then I'll have another one at 3:30 most likely, but
You're
that's
booked
not
for-
going to be the same.
You're booked for the whole time.
Yeah, exactly.
Excuse me, is it going to be here? Is that what you said?
No, it'll be at the community center,
Community center.
senior center, library, whatever you want to call
What
it.
was that again? I missed that.
Oh, that little flyer that's in front of you there. So just to reiterate, that flyer is, if you want to take one of those flyers, that's a Medicare presentation only. That blue flyer is a Medicare presentation. However, if you email me and you're interested in me hosting like a LifeWise, let's say, seminar for LifeWise on the individual market, again, that's not Medicare, I can book that at the same day at 3:30 at the community center. So if you're interested in that, let me know and I will book that time on the same day. Does that make sense? Okay, I know that can be rather confusing, so. I don't see anybody that's taken any treats at all, so on your way out, feel free. Yeah. So I think that's basically it. Let's see, where did my mouse go? Here we go. If anyone has any other questions though, feel free to ask. And there's, again, contact information. Pardon? Yes, yeah, I will be around for a little bit afterwards if you have private questions. Everybody, thank you very much for your time and thanks for the patience as I was getting started here.